Morning, I'm Doobie McDowell.
And I'm Kevin Rennie. Field hospitals are being erected in Rhode Island and Massachusetts. That indicates the overwhelming number of COVID patients needing treatment.
Will it happen here? With us this morning, the heads of the state's largest hospital systems, Marna Borgstrom, the CEO of Yale New Haven Health, and Jeff Flaks, President and CEO of Hartford Healthcare. Thanks to both of you for being here this morning. And Ms. Borgstrom, I'm going to start with you. How close to capacity are you at Yale New Haven Health?
So we are running many of our services in above 90% occupancy right now. Our COVID activity, we have 444 COVID positive patients across our health system today. That's about half of what we had at our peak in the spring. But sadly, a number of those patients are in intensive care units and are on ventilators.
So you're at 90%, yet you have half the number of COVID patients. Did I get that correctly?
Yes, you did. In the spring, when our health system was above 800 patients in one day, we had also stopped all elective admissions, all elective ambulatory cases. And as Jeff Flaks, John Murphy from New Vance Health, and I have talked often, we've learned a lot about how to better handle patients during this pandemic. And our hope is that we will not ask people to defer care for general care that is not COVID related any longer and be able to accommodate those patients and our COVID patients.
Got it. Mr. Flaks, same question for you about your capacity levels at Hartford Healthcare.
Yeah, first, Doobie and Kevin, let me congratulate you and wish you best wishes on the new show. And thank you for having us here today. Similar to Marna, we're in a very similar situation between Yale and Hartford Healthcare. We have additional capacity today. We're planning, for what we think might be the surge as we look into the end of December, January timeframe. And our teams are miraculous. I mean, they've gotten so much better with new innovations, new treatments, new medication regimens, that it gives us the capacity to really manage more people more safely throughout this process. And we're using all of our resourcefulness across the state to do so.
Ms. Borgstrom, we see the numbers that we see from Governor Lamont are statewide hospitalization number of patients. Is there a number that we might reach that makes it difficult for hospitals to carry on their other services to patients?
I'm sure that there is a number. I couldn't tell you what it is, and I don't expect, based on the models that we are all using, that we will get there. We have become, as Jeff Flaks said, very resourceful and much more knowledgeable about how to care for these patients. We have piloted a care at home program where people who do not need acute care can be monitored. We can monitor their oxygenation, their fever, their blood pressure. So I think that as we have evolved care patterns, we're going to be able to provide better and more efficient care to a broader array of people. And as Jeff said, our staffs are amazing. They have done a terrific job, and their ability to expand their capabilities to meet greater demand has been remarkable.
Mr. Flaks, same question.
Yeah, I think when we look at the modeling, what it tells us at this point in time is our health systems, we hope and expect, are going to be able to accommodate the surge that we're anticipating in the second wave. But there are variables, and the variables are Thanksgiving, Christmas, different behaviors that could occur over the time period that could change some of the assumptions around these models. So we're watching very carefully today the testing results that we're seeing, leading indicators, to see if we need to adjust some of our assumptions. But based on what we know today, I do think the health systems across Connecticut really stand ready. Again, the ingenuity that's been put forth to expand our beds, our capabilities, our reach is really been impressive up to this point in time.
I mean, as you can understand, the phrase field hospitals kind of freaks people out when you hear there are field hospitals in Massachusetts and Rhode Island. Do you think we are not going to need to have those at either of your systems, given how the numbers look?
Well, we see the field hospitals largely as insurance policies. So we think that it's a good measure in some instances because it gives us further capabilities. But at this juncture, we're not forecasting an immediate need for them. And we've worked in wonderful partnership with the state. And to the extent those need to be set up, we have systems in place to do so. And collectively between our system, the Yale system, and others, we're well situated, to operate those and stand them up in relatively short order. So, I think it's understandable why people might see that in the neighboring states and read into it. But within our state, we work so collaboratively with the government here and with the governor in particular. If in fact it becomes necessary, we could have those up within several weeks.
Just one, Ms. Borgstrom, did you want to comment on that as well?
I agree with Jeff completely, and I think that the state, as a partner, had expanded all of our inpatient licenses temporarily in the spring, and we were very resourceful in using other spaces. And frankly, it's easier for us to deploy staff if they're in our facilities and in adjacent patient care areas than having, a cadre of people going off site. So we can use those if we need them, but we don't expect that we're going to need them.
Just to follow up on that, Ms. Borgstrom, the pandemic is now visiting states all across the country in a way that it wasn't last spring. Are you losing any healthcare workers to these states where they're offering as much as $8,000 a week to nurses?
We have all found that during this phase of the pandemic, we have not been able to move staff around. We've not had volunteers coming from other states, and we have not been able to hire as many traveling nurses. We have actually not seen much, if any, leakage in our staff. And what we have found is that there are people who are nurses and PAs who have gone into administrative roles who are redoing their skill base and are volunteering to join ICU staffs and others. And so our staff has been very resourceful and resilient in supporting us during this.
Mr. Flaks, I imagine the process of getting healthcare workers vaccinated is taking up a lot of organizational time right now, since they are going to be vaccinated perhaps as soon as later this month.
We're excited, to be in the position today across our state for all of our frontline healthcare workers to, in very short order over the next several weeks, begin to have that vaccine administered. I mean, it's an amazing accomplishment in this country. I mean, when we think about the fact that in March, we started these initial efforts, and to be here in December and administering a vaccine with a 95% probable success rate is an incredible accomplishment. And we stand with all the health systems around the state. We're going to collectively play a major role, and we're going to turn our organizations and pivot so that we can help the state administer this vaccine broadly to the public as the months come forward.
Thank you both very much for joining us this morning.